Good afternoon, ladies and gentlemen. My name is Dr. Michail Ezzat, and I would like to thank Professor Mohammed Fawzi for supervising this presentation, where we will talk about HIFU in managing benign thyroid nodules. Okay, first of all, we will talk about the modalities of treatment of thyroid nodules. Starting down the ladder, we can see open surgery based on anatomy and functional protection techniques were the first and second modalities of choice, but caused great trauma and a higher risk of complications. Then we moved on to the minimally invasive surgeries, which are based on laparoscopic techniques and still caused some complications. And then HIFU was used, which is an extracorporeal non-invasive technique based on imaging anatomy. Okay, HIFU utilizes the distinct properties of ultrasound beams, which can be precisely focused at a specific distance from the transducer. This concentrated energy at the focal point causes necrosis of the targeted tissue while preserving the surrounding structures from damage. So we ablate the target tissue and we preserve the surrounding healthy structures. HIFU is divided into ultrasound-guided HIFU and MRI-guided HIFU, and here are some examples of different HIFU machines used on different body parts. This slide shows just how much HIFU is used in an array of specialties, from neurological, musculoskeletal, oncology, to women's health, cardiovascular, urology, and endocrinology, where we will discuss the thyroid nodules. The research passes through different stages of preparation, from animal trials, small group of human trials, passing on to larger groups. Some modalities are approved in countries outside the US, and some have FDA approval to be used in the US. Then passing on to the final stage is the reimbursement, where insurance coverage is approved for the treatment modality. Okay, so what is the mechanism of HIFU? HIFU achieves ablation effect in two mechanisms, the thermal effect and the mechanical effect. First, we will talk about the thermal effect. As ultrasound travels through different tissues, a portion of its energy is converted into heat. When the heat generation rate surpasses the cooling rate, it leads to a localized temperature increase. Once the temperature exceeds 60 degrees Celsius, rapid thermal damage occurs, resulting in irreversible cell damage throughout coagulative necrosis. So ultrasound deposits heat, increased temperature above 60, coagulative necrosis. The precise focusing of high intensity at a specific point reduces the risk of thermal damage to the surrounding healthy tissues, as the energy intensities in these areas are much lower. And then granulation tissue forms, followed by fibroblast infiltration, and ends with a scar formation. What about the second mechanism, the mechanical phenomena, or called cavitation, which occurs as a result of alternating compression and expansion of tissues when an ultrasound wave passes through them. If the tissue expansion is significant enough, gas is released from the tissue, forming a bubble, which can interact with the ultrasound beam, implode, and leads to thermal and mechanical damage to the target of interest. So how do we check for the response during the HIFU session? In a grayscale ultrasound, we see a hyperechoic region, as seen here, and this is used to detect the effective ablation. So what are the advantages of HIFU in thyroid ablation? Well, HIFU is a non-invasive precision therapy, minimally disruptive to the surrounding tissues, which with millimetric accuracy. It is an outpatient procedure with rapid recovery, and just a few hours the patient is ready to go home. So here are some of the indications of HIFU for thyroid disease, such as symptomatic thyroid nodules, a nodule with increased growth and progression, and we will talk briefly about a study conducted on patients with Graves' disease. What about the contraindications? Well, we have anatomical constraints, such as patients with short or thick neck, as these can complicate positioning and transducer placement. Nodules, which are partially retrosternal in location, are hard to localize or access. Nodules in close proximity to critical structures like trachea, the carotid artery, or the esophagus. Some nodules may be subcapsular, particularly if they are too superficial or too deep. What about the nodule characteristics? Predominantly cystic nodules, as the liquid content hinders the effect of energy delivery. Nodules with macrocalcifications may interfere with the ultrasound penetration, or the third contraindication is medical devices, but this is usually more for the MRI guided HIFU patients with implanted cardiac devices or pacemakers. It may interfere with the device, so it's not advised to do the MRI HIFU for these patients, maybe the ultrasound guided. Some neurological considerations, such as patients with abnormal recurrent laryngeal nerve, maybe, as HIFU may increase the risk of vocal cord damage. Some dermatological factors, like scar, pigmented nevi, or other skin abnormalities in the region of the HIFU transducer placement. And then the last contraindication is maybe mental or psychological status, with patients with significant psychiatric conditions who may struggle to cooperate during the procedure or adhere to the post-treatment care, but this problem is usually solved with the anesthesia. Okay, so this is an example of an ultrasound-guided HIFU, a device called EcoPulse. Here's the robotic head, okay, the cooling and the coupling technology, the ultrasound probe, and the HIFU transducer. This device has a millimetric treatment accuracy. This is another slide about the device seen in action. Okay, now we will discuss the whole procedure for the HIFU session, starting with the pre-procedural evaluation, where there is clinical assessment of the case. Then we do ultrasonographic evaluation to determine the number, size, location, volume, and vascularity of the nodule. Then we do lab tests specific for the thyroid, which are free T3, free T4, and TSH. And then we do some labs for the anesthesia, like the liver function, kidney function, CBC, and bleeding profile. There are some special considerations to bear in mind, like patient's age, where the anesthesia may require an ECG or an echo. Discuss the patient's willingness to do a non-invasive treatment, some nodule-related symptoms or cosmetic concerns to be discussed, and risks of malignancy based on clinical and imaging findings. Then we discuss other treatment modalities with the patient, like surgery, to help the patient make a decision. Okay. Now, during the procedure, it passes by 3 phases. First, the patient preparation. We explain the procedure to the patient, obtain an informed consent. Then we administer local anesthesia. Some anesthesiologists may prefer to do conscious sedation. Some patients may not require anesthesia at all. Then we do optimal positioning for the thyroid axis. Usually, a patient lies in a supine position with extension of the neck. The second phase is the ultrasound guidance. We do real-time ultrasonographic imaging to visualize the thyroid gland nodule, identify the target of interest, and then we monitor the treatment process and assess the treatment efficacy. Okay. The third and final process is the HIFU ablation itself, by application of focused ultrasound waves to the targeted nodule, precise delivery of high-intensity energy to induce thermal ablation, continuous monitoring of the temperature changes and tissue response during the treatment, and then we adjust the parameters for optimal results. And this is a video representation.
In order to cover the entire targeted volume, the operator keeps full control of the procedure through a touchscreen interface, and the real-time ultrasound imaging ensures treatment monitoring.
Here the pulse took 8 seconds in this diagram. Each pulse is 8 seconds.
Green dots on the screen indicate the level of completion of the treatment.
And the whole treatment took 16 minutes.
Parameters at any time, and can of course halt the treatment instantly if necessary.
Okay, what about after the session? we assess the immediate treatment effects such as nodule shrinkage and look for any possible complications such as skin burns, and the most important, look for vocal cord affection. And then we follow up on the patient by ultrasound to monitor the long-term treatment outcome. So in this case, we can see here the size of the nodule, and then follow up after 6 and 12 months, we can see the nodule shrinkage by up to 71.7%. Now we will look at some of the research studies done in the thyroid HIFU field. This is a study about thyroid ablation efficacy conducted on 73 patients, underwent a single HIFU session, and we monitored the nodule volume in 1 week and then in 1, 3, and 6 months. The results were a near 70% reduction in nodule volume after 6 months. This study was a comparison between ecotherapy, which is HIFU, and surgical hemithyroidectomy, where 43 patients underwent a single HIFU session compared to 103 patients who underwent hemithyroidectomy. The study compares the nodule shrinkage symptoms score, thyroid function evaluation at 6 months, also the cost and length of hospital stay, and voice quality assessment. As you can see here, in case of surgery, 20% incidence of subclinical hypothyroidism as compared to the HIFU, which was nearing to 2%. The surgery had longer hospital stay and costs more as compared to HIFU. So HIFU appeared efficacious and safe compared to the surgery. This study was conducted to assess the preservation of thyroid function, where 83 patients were treated with a single HIFU session, and serum TSH and free T4 were recorded as a baseline and then measured at 1 week and then 3 and 6 months following the HIFU session. After the session, no patient developed hyperthyroidism and only 1 patient developed hypothyroidism. Interestingly, this patient had a previous lobectomy, so it's still unclear whether the hypothyroidism was due to the HIFU or the surgery. This study was done to prove the safety and the efficacy of the thyroid HIFU, conducted on 20 euthyroid patients with mean age of about 44 years old, and a mean thyroid volume of about 5 milliliters, give or take 2.7 milliliters. The results were about 50% volume reduction at 6 months follow-up and no serious adverse effects or rebound. This is a case of a 26-year-old patient with toxic thyroid nodule, and here in the pre-HIFU ultrasound showing the size of the nodule and thyroid scan showing the nodule being hot. 18 months after the HIFU session, the nodule shrunk in size, as seen here, and was not seen in the thyroid scan. This is a study conducted on 30 patients with persistent or relapsed Graves' disease. Like we said, we will talk briefly about the Graves' disease. The study was conducted on 30 patients with persistent or relapsed Graves' disease after anti-thyroid drug treatment. The hormonal levels such as free T4, TSH, anti-thyroid antibodies, and the TSH receptor antibodies were evaluated and followed up after 2 and 4 weeks, and then followed up every 2 months for a whole year. At 12 months follow-up after HIFU patients, the HIFU patients showed an overall remission rate of 73.3%, which means a relief in hyperthyroidism, a significant decrease in anti-TSH receptor antibodies, absence of complication in terms of ophthalmic parameters and other anti-thyroid antibody level evolution. And in 96.7% of the cases, the patients completed the ecotherapy treatment within 1 session and were discharged on the same day of the treatment. And so, ultrasound HIFU for the treatment of Graves' disease may be safe and efficacious. However, further studies is warranted before it can become mainstream for this indication. So, to round up this session, HIFU is a non-invasive, precise technology that harnesses high-intensity ultrasound waves for targeted thyroid nodule ablation without surgery or incisions, minimally disruptive by delivering focusing energy to shrink or eliminate the benign nodule while preserving the surrounding healthy thyroid tissue, and rapid recovery as the patient experiences minimal downtime and quicker post-procedure healing compared to the traditional interventions. And so, as a future forward, HIFU embraces advanced technology with a promising potential in the treatment of benign thyroid diseases. These are our references, and this is a picture of our lovely HIFU team and our unit. Thank you.